Hello, everyone. Welcome to our October Walk with a Doc event. Today, our speakers are a second-year medical student, Manasa, and a pulmonologist from UAMS, Dr. Meena. Both of them will be speaking with us today about Healthy Lung Month, which is in October. So really unfortunate to have you both together today. Manasa is a dual MD MPH student, and she's not sure what she wants to do yet, but she'll figure it out. She's got plenty of time. Dr. Meena is a trained pulmonologist trained in surgical oncology. So without further ado, let's just get right into it. I've got a couple of questions for you guys. Manasa, can you talk about the function of our lungs and the importance of taking care of them?
Yeah, so as many of y'all know, we use our lungs to breathe. And the importance of it is that when you're breathing, you're taking in oxygen and you're letting out carbon dioxide, which is made by your cells when it's making energy for everything that you need to do in your body. So that's the important thing, is that we're just trying to make sure we get oxygen in, especially when you're exercising or doing any kind of activity, because oxygen is how your body makes, it needs it to make energy. And so that's the main function of it. And the importance of taking care of them is if you can't breathe, then you can't really live because your cells can't function.
Yes.
So, yeah.
So, Dr. Meena, can you tell us ways that people can maintain a healthy set of lungs going along with Manasa's?
So lungs, as Manasa said, are very important. How you keep healthy is, in a way, how you keep your whole body healthy. So things that you shouldn't do, which will hurt your lungs, are what you need to avoid. So not smoking would help your lungs a lot because smoking injures your lungs directly by causing inflammation, and then you get lung diseases from it. So that's the best way to not have problems with your lungs is not smoke. And then you can train your lungs to function better for the amount of activity you need to do is just by exercising. So even if you have the same lung function, two people, somebody who exercises regularly has a lot more stamina and capacity of his lungs to make up than somebody who does not. It comes in both by your chest muscles and your leg muscles. If you train yourself, you use less energy to do the same amount of stuff. Just like a marathoner can run, say, 56 miles and I can run 5 miles. It's the same difference. So if you train your lungs in your body, they keep each other healthy, but no
Right.
smoking.
No smoking. So, Manasa, can you give us some examples of some specific exercises or things that we can do in the exercise realm to keep our lungs healthy?
Yeah, so, as Dr. Meena was saying, exercise is very important. And I think it just depends on your physical activity level and how comfortable you are. So how far you can push your body. If you're just getting into exercise, try taking walks, like 30 minutes a day, a few times a week. Or if you want to get more into exercise, maybe go running or jogging, or try things like Orange Theory if you can afford it. But just, it's not necessarily that like exercise directly affects your lungs in like a big way, but it's just there's so many good things for your whole body in general, because obesity can be a huge factor in how well you can breathe. Your heart can go bad in many ways, your liver can be affected, and just like your whole body. So you want to make sure that you're moving every day so that you can maintain your weight and health.
That's good. So, right now we're in the middle of a pandemic still, and we've had so much, COVID is everywhere. It's being talked about on the news, on the radio, everywhere you look. And one of the main things is, people talking about how COVID affects the lungs. Dr. Meena, can you explain to everyone how COVID exactly affects the lungs?
So basically, it's a virus which your body enters your cells and then replicates in them. And when the replication process, causes a lot of infection in the lungs, and then your lungs fight the infection, and there's a lot of inflammation. So basically, I would say your lungs have to be like a helium balloon, full of air and floaty and light. After COVID, it would be like a water balloon, all full of water and saggy and heavy. So you can imagine if you had a lung that felt like a helium balloon, you would breathe easier and if you wanted to exercise, it would feel good. But if your lungs felt like a water balloon, it'd just be heavy, trying to breathe more with taking a lot more strength to make that water move is the same thing. And that's why, and because the water is also taking up all the space for the gas exchange, so oxygen can go into your windpipe, but then that water stops it from making the next step, which would be from going from the windpipe into the body, because there's a water barrier between the two. So between the inflammation and the fact that all the whole lung is swollen, it decreases the amount of oxygen that your body can absorb. Your body doesn't absorb oxygen, like Manasa said, then it can't do what it needs to do. So all the organs start shutting down. You have to work harder to breathe, which makes your heart work harder to pump blood between those. Then they hurt each other, and then when there's all that inflammation going on, your kidneys don't work, and as slowly the whole body kind of shuts down. And that's why you need to have a lot of support, not only being giving oxygen at a higher rate than you would, or have to put you on ventilators and all those things to help your body get through this and hopefully get you back to a air-filled balloon at some point.
So I have a friend that recently recovered from COVID, and her doctor had recommended that she start back as slowly as possible. Um, do you guys think that maybe just starting out with walking would be the best way to start if you've had that type of respiratory infection and are cleared for exercise?
So that would be important that they cleared for exercise because most people would be. It's just that depends on how severe the COVID was. If you're in the hospital for a certain amount of time, walking itself would be a challenge because just getting out of bed would be an immense. But if you can do it, then just walking for a person who just had a COVID bout, which they got over at home, then walking and then slowly starting having uh, more training as you go along would be the best way. But COVID takes a while to get better. I mean, their case reports of people still being short of breath and not being able to do what they were used to 6 months down the lane. So walking is very important step of it keeps your legs stronger so that you don't make your lungs work harder to do the same thing.
That's a great explanation. Guys, thank you so much for coming together to talk about Healthy Lung Month and letting us know a little bit more about the role that our lungs play. And I'd like to invite both of you to go on a walk next. Are you guys ready?
Yes.
Yes. All right. Well, happy Lung Month, everyone. Thanks for joining us, and we'll see you again next month. Thank you, guys.
Thank you. Bye.
Awesome.
Hello, my name is Tia, and I am in the 5th grade at John Roberts Elementary School, and I am doing virtual school so I can stay safe and healthy. When I go to school, I also do virtual school because I want to stay strong and healthy. I also go on walks so I can bike and get my energy.
Welcome to the Walk with the Dog program. I am Priya Mendirada with Geriatrics. And the good part about walking, you can walk at night, you can walk outdoors in lighted areas. As you can see, we are enjoying the full moon night walking. Walking has great benefits for everyone, including your memory, your mood, your brain, your heart, your muscles. And for all those people who are at home, continue to walk. You can walk in your backyard. You can walk with a walker or a cane. All those kids who are home doing virtual learning, walking is great for them in the evening times or whenever they get a chance. So continue walking. Thank you.
You got blood.